Good evening, everyone. Good evening. You can go ahead and type your name and your campus in the chat. Get your cameras on and just get yourself in position. We'll start. We have 7 minutes. Good evening. Good evening. Are there any questions about anything before we get started? We still have 5 minutes. Any questions about anything? I did just post an announcement with some additional exam review. So that's something new within the last few minutes. So there's another, we have them all like in one document. So that was a new announcement. Good evening to those that are just coming in. We do have 3 minutes before we actually start. If you would, go ahead and get yourself in position. Ensure that your cameras are on. Type your name and your campus in the chat. And if you have any quick questions, I can. We have 1 minute and we will get started. 1 minute. Let's see. All right, good evening. And it is 5 o'clock. It's at the top of the hour. Good evening. And how is everyone doing today? Everyone's doing well. That's good. Okay, so just as a reminder, housekeeping, you do have to have your cameras on. Go ahead and type your name, your full name, and your campus in the chat. You do have to keep your cameras on at all times. Even if you have to step away to use the restroom or something, your camera should remain on. Just as a reminder, these sessions are recorded. The chats are recorded. All your digital footprint of you turning your camera on and off, all of that is recorded. So just, so that you all can be informed. And the recording and the chats, everything is turned in, submitted. So just to let you all know. All right, so have everyone had a chance to look at your syllabus? Have you planned out your term? Even though if you have to, adjust some things, make sure that you're looking at the syllabus and looking at the due dates and what's due. And because most of you all have at least 2 to 3 classes. So it's going to take some preparation and just trying to figure out when you have to do what and what you can do and what you cannot. You have to identify those things that you cannot do. Are there any questions about anything before we move forward? Okay, be sure to rename yourself. You're on the screen as your device. So ensure that your name, your first and your last name is there. Okay, thank you. So let me go back through the announcements. I did just post an exam review. So that has been posted within the last couple of minutes. So that is new. The group assignment, I did realize I left off the phone numbers. So I will go back and resubmit that with the phone numbers there, but you all go ahead and reach out to each other so you can go ahead and get those things planned and, so that you can have time to revise and replan. We will post some examples, some templates, some samples of some prior students' work so you can, see, have an idea of what it's, how it's supposed to go. And if all goes as planned, you will remain in those groups for your other project also, the infectious disease project. But both of them, we will give you examples to review. There is another project that's you do it individually. So it's an individual project, PowerPoint, and we'll give you an example for that also. But I will go back and repost with the phone numbers so that you all, because most people, what they do is they create like a group text message, and you can use whatever means necessary to communicate, whatever you all feel comfortable with. Emails, text messaging, sometimes you all duo, but whatever it is that's necessary. All right, so our plan for tonight is to review some concepts. I'm gonna need to hear from you, so you will have to unmute and talk back to me. And then we'll go over the case study, that form that I posted in week 2's information for the week. And that should take us right on up to 6:30 my time, 7:30 your time. Okay, all right, so I'm gonna go ahead and share my screen here. So I will need to hear from you. Wait a minute. All right. Okay, are you all able to see the screen? There is, what is one thing? Are you all able to see the screen now?
Yes.
Okay, so we're just gonna let me hear from you. I need to hear your voices, and even if this is a safe space, so even if you say something that's incorrect, we, your team members, we will correct. So don't be afraid. So what is the one thing that you've learned about the history of nursing? This is just review from the chapters you're assigned reading. What's that one thing that you learned from the history of nursing that stood out to you? Anyone?
I thought the frontier nursing was interesting about them traveling on horseback to the people in the mountains in Kentucky.
I tell you, the nurses, I tell you, in horseback, car, I have a story toward the end. You just never know what means that you'll end up, for the most part, nurses will do whatever's necessary to provide that care. I don't know. That's just how we're made up. Horseback, motorcycle, doing what I call it, a donut in the middle of the road when you see a car, lunch between two trees, whatever. So frontier nursing, good. Someone else, what's that one thing that you learned or just stood out to you? You thought it was like really, really interesting? Let's hear from 2 more. Cheryl, looks like you're talking. We don't hear you.
My dogs are going crazy.
Oh, okay. That one thing, Miss Amy? And these are not trick questions, you all. It came from the assigned readings. What's that one thing that you learned about nursing that you thought was like, that was pretty interesting?
Lillian, what's her name? Lillian.
Wow.
Yeah, I'm sorry, but I found that interesting, how she started her the home nursing practice.
Mm-hmm.
So I don't know, I felt like it was interesting to me.
Great. Thank you both for sharing. Good. Let's hear from one more person. What's that one thing that stood out to you or that you learned about nursing?
The one I read was the segregation in nursing. So like earlier when I was talking about like what was like color, like was it nursing education for like Black people versus like white people, and how like I guess you have to like learn the same stuff essentially. It's just Black people would get paid lower wages versus the white people for doing the same thing.
Thank you for sharing. Great. Thank you. Has community health nursing existed for a long time? Do y'all think it's been around for a long time, or is this something new?
Very long time.
Very long time. Dark ages. Yes, I would agree. So why do you think public health is at the forefront of conversation now? Public health, public health, public health. That's the buzzword. What has happened and what is happening?
So
Because
many
of the pandemics that's
illnesses.
going on.
COVID.
More people is sick, and just the numbers of different chronic illnesses is just increasing in the community.
And lack of adequate care too.
Okay, great. Lack of adequate care. People are living longer. Because we have advanced, we're finding out that people have all these different diseases we really never really thought about, or they were there, but people just really didn't occur as often. And so, and the other trend, the pandemic has trended us to, just bringing that to the forefront and just having that conversation. Hey, you all, the public. Yes, we're taking care of the people in the hospitals, the long-term care facilities, assisted living, but where does all of these different pieces fall up under? And it does fall up on the public health. Yes. So what does public health nursing allow you to do versus bedside? So public health nursing versus bedside nursing. What's the difference, or what are the opportunities or the things or the tasks that you would do or would not do?
It helps you to understand the family better, and you get, I think, better information because it's more of a relationship, a long-term relationship.
I love public health nursing. I got to take a contract and work with the public health department and just doing community focused care, like going to farmers markets and doing blood pressure things and doing vaccine clinics and doing like seatbelt and car safety for infants. That was a really eye-opening experience, and it was a lot of fun.
Anyone else? Taking the healthcare to the people, wherever they're at. Okay, thank you all for sharing. Affordable Care Act, what do we know about that?
It was implemented to allow people to better afford healthcare.
Okay, anyone else? They sometimes refer to it as the marketplace too. I actually had the opportunity, we were doing just a community service project, and before Enroll Alabama ended, or the normal enrollment period ended. And so I didn't know that it actually, once you put your information in, that it actually pulls up like several plans. From what I've been hearing, it's not the best healthcare health insurance plans is out there, but from what I saw, there were numerous of plans. You just had to decide which one worked best for you. There were some that had some, I couldn't believe it. The deductibles were so high, but on the flip side, you got all of these things, the preventative appointments, and it covered all these things that you wouldn't normally think that it would cover. But on the flip side, your deductible was extremely high. And so, but that marketplace, it did give the people a choice. It really did. And I didn't realize that it really did. I thought it only pulled up maybe like one, maybe two plans, but it did give the people an opportunity to make a choice, to look through. And the representative, she actually was the case manager. And she actually, she had the conversation with the people, like, what disease processes do you have? What medications? What tests have you had in the past? Have your doctor said what tests you might need in the future? And from that information, she kind of like pointed out, well, hey, this plan might work best for you because this one covers 100% of all of these other tests and exams that you might need. Because this plan right here, it will you'll have to pay out of pocket. So I just thought that was new information for me. So
yeah, I was gonna say with that, so it's why some people may feel as though that it's expensive is because when they go in, it is kind of like based on your income, but they gotta also take a look at how much money you have to spend for insurance if you don't use that marketplace. Because I've went up there and put it in with my income, and it was asking for like $200 something. Technically, that's not bad for some insurance.
Yeah, and just to piggyback off of what Latasha was saying, I actually pay out of pocket. So once they did the breakdown, like you were saying, all the options that they give you with the higher deductibles and everything, with the higher deductibles, I end up having like lower or no co-pays at all. But I do end up paying somewhere around about $300 a month, but that's my health, my vision, and my dental. But I had to still break it down to what I was paying when I was getting insurance from my job, and it still kind of balances out to almost about the same.
Thank you all for sharing that. Yes, and it does take that time to look at it. And another thing, one of the plans, it was whatever your copay and whatever you, because I was at the deductible thing, I only thought certain things went towards the deductible. But some of the plans, everything that you pay went toward that deductible. It wasn't all of the plans. And I thought that was, you know, that was new information for me too. And I was like, well, I didn't think everything that you paid went towards the deductible, but in some of the plans it did. So if in the event that you did have to go to the doctor and pay that copay, that money did go toward it. In the event that you had to pay for something, some lab test or something, it actually went towards that copay. And so it did kind of, like you say, once you sit down and look at it and you weigh them up against each other, there some plans it was almost the same. But yeah, it's an individual case by case decision.
And I think a lot of it too is like I said, it ended up being almost the same about what I was paying when I was getting insurance from my job. But the difference is when you get insurance from your job and they do automatic deductions, you don't think about it because you never see it. It comes out, you know, what all your other deductions as versus you got another bill that you're like, oh, I got to pay this, you know, so my insurance can keep going for the next month.
That is a great thought. You're right. You never, because who really, I mean, we really don't really look at the deductions. You know, we know all those people on there, FICA and whatever those people are. And we really don't look at that because it's like, you know, if we don't see it, it's not on our mind. So you're right. But because you have to actually send that payment in, then it's at the forefront of your mind. So, but yeah, that's a good thought. Never really thought about it like that. Medicaid and Medicare. What do we know about Medicaid and Medicare?
Medicare is for 65 and older, and those that are disabled, disabled, and Medicaid is for people that's low income.
Okay, there was someone else talking. Go ahead. Thank you.
I said it was for people who are underprivileged, like the low income, homeless, the low poverty.
Which one?
Medicaid.
Medicaid. Okay, great. Thank you all for sharing. Anyone else on the Affordable Care Act, the Marketplace, Medicaid, or Medicare? Anyone else?
I had a question. Is Medicaid for just disabled people too, or is Medicare for disabled people?
It depends on your state, and it just depends on what the disability is. So, but for the norm, for the most of it, Medicare is for the disabled. But then it goes back to your state rules and the disability. Anyone else have any information on that?
I believe Medicare is also for people that have a need, like for skilled care. Medicare will cover those costs.
Exactly, that is correct. So for example, if someone has a new stroke, and they end up, I know like in our state, they get what we call a 21-day stay in a skilled facility. And, you know, they're able to get that physical therapy, stay in-house and get all that therapy that they need. And Medicare actually takes care of that actually pays for that. And that's something, even if they don't have Medicare, but if they, I forget what the, I don't think you have to be 65 for that, but if it's a new condition, a new chronic condition, and they qualify for that. But then after that 21-day stay and they've met their, what's the word that they use, their maximum potential, then it ends.
That the spin down you're talking about?
I think that's what they call it. There is another word for it, spin down, and because you can go up to 100 days, but the norm is just 21 days. So there's like these little gray areas there, but for the most part, yes.
The guys in my facility get Medicaid for 6 months when they get out. I work at a prison. They get Medicaid. They get Medicaid for 6 months when they first get out to help get them stabilized.
Okay, good. Anyone else like to share? Because, you know, in our different settings, you know, it varies. Anyone else like to share? Go ahead, please do so. Okay. Okay, what programs are there for low income individuals? We talked about the Medicaid.
Food stamps, food card, whatever.
Food stamps and like the SNAP and the WIC, I always see.
WIC, yeah.
Yes, yes, those
There's
programs.
also housing programs too, like FMHA, Farmers Home Administrative, that helps with
Child
low
care
income.
assistance.
Yeah.
Okay.
Child
What
care
was
assistance.
healthcare assistance?
Temporary child care assistance, temporary
Child
assistance for
care.
needed families.
Yes, child care. You're right. You're exactly right. Yes. Great. So what is the focus of community-based nursing? If we would have to throw some words out, what is the focus?
Education.
Education, by way of health promotion, yes.
Protect the
Prevention.
people,
Protect, prevent, yes. Exactly, great.
promotion, health promotion.
Yes, great. Right, thank you all for sharing. So, delegation. So who can we delegate? What things can we delegate? Can we delegate a patient that they need a bath, they need vital signs taken, but they're unstable? Can we delegate that patient to be assigned to an unlicensed those tasks to an unlicensed personnel?
For meeting that patient, I would say yes.
You would say we can delegate it to the unlicensed personnel. The task at hand is we need vital signs, and the patient needs assistance with ADLs, a bath, but the person is unstable.
No,
They can just
I
come
would
with
say
it.
no.
because they're unstable.
Say that again, Miss Tanya.
I said no because they're unstable.
Okay.
And I would say no, because they have not received training in those areas, like for instance, vitals. So if the person is not if I'm understanding you right, if the person is not licensed, how can they perform that skill?
Okay, so let me just be a little bit clearer. For example, a certified nursing assistant, can we designate or give them assign a patient to them that is unstable, but the only thing we need them to do is give a bath and take vital signs?
Yes, you
Yes,
can.
you can.
So
They
why?
can take, you can give them a bath and you can take the vital signs. It's not necessarily like if you're not available to go in there and assist, because you can assist if they're that unstable, but they can give them a bath and take the vital signs.
Bathing and vital signs is in their scope of practice.
But also, like, don't you need more information? Like, are they bed bound? Are they like an assist ×1 ×2? So like they could be unstable, but if they have like a walker or some sort of ambulatory aid, they could possibly help them, since ambulation's part under or is considered an ADL.
Anyone else? So the one thing that changes the whole scenario is that the person is unstable. So even though that certified nursing assistant can do the vital signs and they can prepare the bath based on whether or not they need one person's assist, if they need setup help, or if they need two persons assistance. But the one thing that changes that delegation is that if that person is unstable, because remember, we can't delegate things that need to be evaluated, taught, or if an assessment is needed. So if that person is unstable, we cannot assign those tasks to that unlicensed personnel. But if they were stable, we could. Okay. So health risks can be reduced through a variety of approaches. Health risk reduction is based on the assumption that decreasing the number or magnitude of risk will decrease the probability of an undesired event to occur. So let's talk about alcohol and drug use. So what are some things that we can do to decrease? Decrease is the buzzword for health risk. We want to reduce or decrease. So for alcohol and drug use, what are some things, some interventions that we can do to decrease that use? I think I need to move this off.
Educate.
Okay. So let's take it a step further. If we're talking about an adolescent, what are some things that a parent can do, or you would suggest that a parent would do to decrease substance abuse in their adolescent?
To not drink around them.
Okay, not drink around them. Good. What else?
To make sure that, to make sure if they have it in the, not if they have it in the home, that it's locked up or not accessible.
I think I heard both of you all say availability. If the parents are gonna use it, make sure it's not accessible. I think that's what I heard both of you all saying. Okay. What else would you advise that parent to do with that adolescent?
Get them in treatment program.
Okay. In the event that there is substance abuse, get them in treatment program. And even before then and throughout. What
Talk to
about
their kids,
say that again?
talk to their kids about staying away from drugs and alcohol.
Exactly. Encouraging just to have that conversation specifically about that. Yes. Just have that conversation. Health risk appraisal, the process of assessing for the presence of specific factors in each category that have been identified as being associated with an increased likelihood of something. For example, increased likelihood of cancer or increased likelihood of an automobile accident. What would you ask that person? What would be that conversation? So you are trying to prevent the likelihood of something happening. So let's talk about the automobile accident. What would that come? What would you ask that person if they were at an adolescent? What would you be asking them about?
Do they wear their seatbelt?
Do they wear the seatbelt? So what would go ahead?
Do they talk on their cell phones while driving?
Exactly. Good.
Texting.
Texting on the phone. Good. Wear that seatbelt. What conversation would you be having with the parent of a 2 to 4-year-old in reference to an automobile accident? You're trying to decrease the likelihood of an automobile accident happening. What would you be asking?
Making sure car seats are fastened and they're fastened in the safety belts.
Okay, great. So remember, when you are taking your exam and you're looking through and reviewing questions, you want to identify what is the concept, and then take it a step further. What's your population? Who is the who? So we talked about automobile accident, but our answer choices, our interventions were different when we were talking about an adolescent versus a 2 to 4-year-old. And you all did really good with that. So remember that when go back through that question or the scenario and say, well, wait a minute. Okay, I know this is the topic, but who is my population? Who is the who? Who are we talking about? So what is a family crisis?
When a family has a problem that they can't cope with and handle.
Anyone
Is that
else?
right?
Family crisis. So would you say that they're coping, not coping, organized?
They're not able to cope with it.
Okay. So something has happened and it's taking them out of their routine or their norm, whatever it is. It could be that something has happened to the breadwinner of the family, or the person that usually the caretaker of the family, the designated person that make sure everybody gets to where they need to be, doctor's appointments, the children to school. It could be that person, something has happened to them. So something has happened outside of the norm. And
like losing a job.
Exactly, the breadwinner, not being able to provide the resources. Exactly. And so we're going to talk about that family being able to cope versus not coping, and being organized versus not organized, and functional versus dysfunctional. So give me an example of a situation, a family crisis, where the person states something, and it indicates that they are coping or functional. Just give me an example.
I think if the family says that we can do this or we'll get through this, that's indicating that they're trying, that they
Okay.
haven't given up.
So they have stated what has really happened. They have voiced, this is, we, this has happened to us. This is our situation, but we can move forward. The person has, I'll give you an example. The breadwinner of the family is no longer, is unable to work for 6 weeks. The person states that, but then they also state, Mr. Nurse or Miss Nurse, can you identify some resources, some community resources that can help with some finances, to help buy our groceries, to help pay for our bills, to help pay for our childcare? Remember, we just talked about these. We identified the things in the community that people could, resources that people could use. So the person states what is really going on, but then they ask for that additional assistance, those, for you to identify those resources. So that's why we're saying that person is coping, is organized, or functional. But if the same person states, well, hey, Jim is out of work for 6 weeks. I just don't know what we're gonna do. I guess we'll just all just sit here and just wait for those 6 weeks to end. That is considered as not coping, not organized, and dysfunctional. So your interventions would be to help that person come back towards being functional. Well, hey, we understand this is what you have going on, but let's think about some resources and some phone numbers we can call, or some, this center does this program. We have this program at the local church that can provide assistance with paying utility bills. So you might have to decide or try to get them back toward being functional. So the family crisis is not being able to cope with an event because of disorganized or dysfunctional. The demands of the situation exceed the resources, whatever those resources are. If it's finances, or if it's, like I said, that caretaker, the one that gets everybody where they needs to go. I know in a community, they have like this elderly lady, and she is 89 or 90, and I kid you all not. She is the person that gives the kids to and she does this for several people on her street. Like, they have younger children. She gets the people to the daycares, to the schools, if they need a ride to work. And she's 89 or 90. She's the little person that, she gets the people where they need to be, and is needed. And if she's not there, then what would those people do? Of course, they would have to identify some other resources, but sometimes it's not just money, it's people helping, doing those different things, that if they're not there, it's detrimental, to the family. Okay, we gave an example of that. So, assessment of families. What should be established before beginning an assessment of a family? Just think about, if someone's coming to assess you, what would you want to happen first?
Get to know them a little bit.
Like, their background, yeah.
Building a rapport.
Know their history.
Good. And so you want to build that rapport, and while you're doing that, you're going to gain more information. You want to know who's going to be there, who the members that will be present, the preferred time of day, what other information is needed, like where's their location, and then the purpose, because they can think you're coming for one thing and you really are going for something else. Go ahead, I'm sorry. Oh, I thought someone else was talking. Okay. We did that one. Let's go on down. Just a few more concepts, and we're going to move on into our next activity. Okay, so a DNR. What is that?
And do not resuscitate. We don't provide CPR. We just let them pass naturally.
Okay. It's an order by a physician that indicates what you just said. Exactly. CPR, cardiopulmonary resuscitation, this should not occur. So what about an advanced directive versus a living will?
It's an advanced directive where you give the permission for, like, say, like, if my mother's ill, I have the right to tell them what treatment she should get. Know what that is? Or no?
Now, which one did you say that was?
Advanced directive.
Okay, an advanced, that's part of an advanced directive. That's
Okay,
part of it.
okay.
So let's talk about a living will. What's a living will, you all?
It's what the person wants if they're unable to say what they want. But it's in like writing.
That's right. It's in writing. Exactly. So on the other side, what is a durable power of attorney?
That's when they,
assign somebody to make decisions for them.
yes, thank you.
Exactly.
That's the
Exactly.
one I was thinking of, yeah.
Okay.
Okay.
So that's great. So the living will is in writing. The durable power of attorney is that someone that they've designated to make those choices. And the advanced directive is the broad category that includes all of that. So these are testable things to you all. Make sure that you're understanding those different concepts. So what's the purpose of the nurse practice at? Like the overarching, the big goal, purpose.
To make sure we do no harm to others.
Protect, exactly. Do no harm, exactly. And then what does a nurse practice act? What are those things that they placed out there or regulate to ensure that we do no harm or that the public is protected?
If we're operating under evidence-based practices.
And from those evidence-based practices, they create what for us? What's that thing that you all are gonna have to take it? Well, you all have taken it one time, but that test that you take at the
You're
end.
talking like licensure, like
Licensure.
license exams.
Exactly. Good. So it regulates the licensure. It the scope of practice. It helps define what that scope of practice is, and they kind of vary a little bit from state to state. It even within that scope of practice, it defines what our qualifications are, what skills and which competencies that we are allowed to do, and what constitutes or what says that we are competent or not. Yes, and it's there to protect the public. Okay, so we're down to school nursing. Let me see. I'm gonna bypass this because I have two little short videos to show you on school nursing. Yeah, and we'll come back. So Healthy People 3030. What do you know about Healthy People 3030? What's the purpose of that? What does it do? What is it there for?
To encourages healthy living.
Exactly. And how that and by way of what? How does it do that? What does it create for like the nation?
Goals,
Goals.
like objectives that they can track and monitor, like measurable. Yeah.
Exactly.
Goals.
And from that, they create, different healthcare facilities, they create policies, opportunities. Leaders are engaged so that, that they can start creating bills and things on that level. The focus is eliminating health disparities. So it sets that big picture, but then it drills down. Do local governments provide funds so that parks, people have walking trails, promotion of healthy development and healthy behaviors. We say, hey, you all need to walk, but in the communities, they don't have a place to walk. So, what is there to help with that? So that's when the leaderships and policies and things are created so that the funds are there so that these things can actually take place. And those goals, they change for the most part every 10 years. They're revised. So you do, like I said, these things are testable, you all. So when we do counseling, what is the outcome of counseling? What do you want to see or know that has happened?
Like improvement, or the goals were met that you gave them?
That they understand.
Okay, good. Because you want the people to make an informed decision. You want them to make an informed decision. Exactly. So when you are discussing whatever that is that you're discussing, you want to ensure that you've given them enough information that they can understand. If they don't speak English, if they don't read, you know, if you're giving them information to read and they can't read, can they make an informed decision? It's just like you're giving them a pamphlet that's in English and they can't read it. So make sure that the information that you're giving them, verbal and or if it's in writing, that they are really understanding it. And we should ensure that we're not being judgmental about whatever it is that they decide that they want to do. Because, you know, we'll come up with all these interventions, but it's up to the patient to decide, hey, you know, I really don't want to do that. We can have some beautiful interventions. But if they decide that they don't want to actually partake in whatever, then we have to be non-judgmental about that. Remember, reduction in health risk of individuals is the goal. It's the goal. All right, and let's talk about the levels of prevention. What are they?
Primary, secondary,
Tertiary.
Okay. All right, and what is primary? If you were trying to tell someone what it is, what it entails, what would you say?
Prevention, like vaccinations.
Okay. So primary prevention addresses the use of interventions before the disease occurs, before the injury occurs, before the deficit actually occurs. And the whole point of it is to reduce it from actually happening. Anything that you do to prevent the disease or deficit or injury before the disease, injury, or the deficit occurs. That's primary. Okay, so what is secondary?
Secondary is the screening process.
Mm-hmm.
like vaccines.
Okay. Okay, secondary is aimed at detecting, we're detectives, detecting the disease early through screening and early interventions. For example, screen, detect, surveillance, surveys, tests. Remember, we're trying to figure it out. So we're gonna have to take these concepts and be able to apply them to a scenario. So for test purposes, you have to know, you know, what secondary prevention is, what primary and tertiary is, but then apply it to a scenario. So make sure that you go back and understand, you know, what it actually is. Secondary, we're screening, we're detecting, we are doing some surveillance or some tests, trying to figure it out.
Can you give us an example of maybe surveillance that doesn't include specifically like the word screening? Do you know what I mean?
I think it's tomato, but for
Okay.
example, you are the employee health nurse and you are giving TB skin test. But before that, there has been identified that the staff has a potential exposure to tuberculosis. And so you end up giving TB skin tests. So we don't really know that anyone really has tuberculosis, but we know the exposure has been there. So at the same time, we're trying to screen or, you know, surveillance or keep an eye on or trying to figure out. All of these are kind of like the same verbiage, if you understand what I'm saying.
Yes, thank you.
Mm-hmm. So another example is a person that's going in for, like, they have recommended that people have colonoscopies or do the box, you know, the little guy with the little box with the legs. So that's a surveillance or a screening. Is a screening colonoscopy, which is different from a regular colonoscopy. So if a person has had some polyps or actually have, you know, some GI problems in the past, that colonoscopy would not be considered a screening colonoscopy. A screening colonoscopy is that one that they're promoting you to go ahead and get done at the age of now, I think it's dropped down to 45, or to do, or to send in, request a little box be sent to your home and you send in the stool sample. So those are some examples of secondary prevention. Okay, so tertiary, what is tertiary?
Tertiary is you had the disease, but now want to prevent it from progressing.
Okay. So tertiary prevention includes those interventions aimed at that disability limitations and rehabilitation from the disease or injury or disability. The disease is present, but you're trying to manage it and help the person live without complications. So think about all those things. So for example, you know, a person has diabetes and you're encouraging them to be compliant with their glucose checks, with taking their medication. But on the other hand, going back to secondary, if you were at a health fair and they were just doing glucose checks, that would be a screening. You know, people just randomly just coming in getting that done, but because it's not a disease process there. Ms. Johnson, were you saying something? Okay. All right, so here we go. Which level of prevention? A nurse advises a client with an active communicable disease not to donate blood, plasma, or organs.
Would that be tertiary because it's an intervention or what's happening after
So
you have the disease?
They already have a disease process. Exactly. It's already there. Yes. The school nurse is asked to attend the PTO, the parent-teacher meeting monthly. The nurse task is to provide educational programs about injury prevention.
Tertiary. I mean, primary.
Primary. Yeah.
Sorry.
Primary. Good. Okay. Okay, so let's talk about ADAPI. We know we do a head-to-toe assessment, no matter if you're in PEDS class, no matter if you're in mid-surg, if you're in community, you still do that head-to-toe assessment of your community, of whatever it is that your task is that you're going out to do. And so what does ADAPI stand for, that acronym stand for?
Assessment, diagnosis, planning, intervention, and evaluation.
Okay, so remember when you're doing your taking your exams, identify whatever that concept is that the question or the scenario is talking about. Sometimes these words are in there and it says, you know, if you were evaluating, but then they have all these answer choices. And the answer choices, some of them will be correct for assessment, diagnosis, and planning. But remember, the question is asking you about evaluating. So remember that when you're taking your exams. What is the question? Like, dissect the question. Okay. So next we're going to do is look at these 2 videos on school nursing, and then we will move on into our case study. I'm going to stop sharing and pull up our videos here. If you have not placed your name and your campus in the chat, please do so. Thank you, Ms. Diane, for sharing that information. I just saw it when we were talking about the alcohol abuse or drug and alcohol abuse. You mentioned don't drink and drive. Good. Thank you. Let me pull up our videos. Okay. So school nursing is a specialty. So what setting are they in? What are school nurses? What setting do they work in?
Community. In the school.
In the school. It wasn't a trick question, you all. They work in the schools. Exactly. Sometimes they have several schools that they cover. It just depends on the population. They do their head-to-toe assessment, and you know, they actually sit down with the head school nurse, with the school counselor, because you know, they, for the most part, they fill out these health forms. And so they have to identify the health needs of their population, of their community. So the school is the community. And from that, then they decide, well, hey, you know, we can just, I don't want to say get by. This school will only need a nurse present in the event that emergencies happen, because we don't have any chronic diseases that we're having to manage. So that is a conversation that they will have to have, and the school district will have to decide. Sometimes they have to hire more staff to come in. It just depends. I have worked as a school nurse, and sometimes it just depends. One school year or either halfway through the school year, we would have had to do all these skills, but then people move, things happen, children change schools, parents got jobs in other towns, and the parents found it to be, more economical for them to move. And so certain skills we didn't have to perform anymore. For example, tube feedings, intermittent calves, and things like that. And so the acuity just wasn't there. So we had to adjust ourselves. So then the other school nurse would have to go to the other school. So it's just like an ongoing thing. So that assessment is done. Okay, so let me show you these little short videos here. And you're pretty much out there. You bring to the school nursing, you bring all of your tools in your toolbox, all of them. Because remember, we have in a lot of school settings now, they have the pre-K. So those babies are like 3 and 4 years old. That's on campus. That's on school campuses. They don't mix in with the other students, but they are there. And in the event that something happens, you are it. So you bring in all the tools from your toolbox. Even if you have staff that OB. So when would you think you would have to use OB as a school nurse? We hope you wouldn't, but you might have to if what was happening.
The pregnant teacher was having a baby, maybe?
Exactly, having complications or something going on. I'm telling you, you would have to bring all your tools that you have from all your class. And I say tools, all the things that you've learned, all those skills from the specialty classes, from Peds, OB, all of them, because you just never know. You just never know. All right, so here we go. Make sure it's turned up.
I'm the school nurse. I do a little bit of everything from ice packs to abrasions and cuts to immunization compliance. We cross over into playing counselor sometimes. So much more than ice bags and Band-Aids.
A lot of our kids that are maybe dealing with something emotional or a challenge at home, the first thing that will come up is something physical, right? So a headache, a stomach ache, something like that. So I'm often the first person that they see in that type of situation and can determine, is this something that's a physical cause or is this more of an emotional thing going on, and then get them the help that they need right here at school. My job covers a lot of different arenas. I also help case manage kids with chronic conditions. Some of them are medically fragile kiddos. They pull it up to 60. Maybe they go see their doctor every couple of months or once a year, depending on the severity of their condition. But I am one of the most consistent healthcare providers that kids see since I am here at school.
So you get pain and then you feel like you're going to throw up. I work at long-term care and then I work at the hospital setting. In the hospital, we're pushed to our limits these days, expected to do more and more with less and less help. Here at the school, you get to work with kids and hopefully make a difference in their life and see them smile and be with them during struggles as well as happy times. And, so you get to see kind of the whole gamut with them. And I love that part.
I like that I can build relationships with staff, with kids, with families, because I am here 5 days a week, and I am a consistent part of their lives, and can be a person that they trust and that they know and that's familiar, that they can come to when they're not feeling well, when they're in pain, when they're scared, maybe.
Okay. What are some key points from the video?
One of the things he said, that you never know what you're going to run into, from ice packs to the different things that could happen. So.
That you're going to be just about, you're going to play every role. You're going to play mother, you're going to play nurse, you're going to play friend, you're going to play everything that you can ever think about with those kids.
Someone else. What was some key points from the video? What skills did you see being performed in the video? Did you see any skills?
Breathing treatments.
Tube feeding.
Yep, those things happen.
Counseling.
Okay. So yeah, that one guy, he was saying, so what do you think he was trying to get at? Was it really a physical problem, or it could have been probably something else going on with that child? With that questioning that he was asking, what did he say?
Determining whether it's a physical or emotional issue.
Mhm. Because it could be what's the big thing that's going on in schools now? Begins with a B.
Bullying.
Bullying, exactly. And sometimes they come to you almost the same time of day with the same complaint, but when you do your head to toe, you're not really finding anything. And so you have to, after that second time, you need to dig deeper, start, change the line of questioning, because more than likely it's probably something that's going on. Yes. So for the last couple of years, nursing has been the #1 trusted profession. We have beat out firefighters, nothing against the others. We love them and we need them, but nursing has been the most trusted profession again for, I would say, over the last 5 years, if no mistake. Okay, here's another little short video. Let me share my screen. Okay.
Kids are a lot of foster kids, a lot of parents that are not in the picture. And we've got about 500 and some kids. So I'm the sole medical provider of, over 600 people here. It's been going on here. I have been here for 2 years as a school nurse. Before that, I did trauma, ICU. Here, it's completely different for me. I love it. There is so much more than like Band-Aids and boo-boos. I mean, there are days when we're busy, I get to see over 100 kids a day. I have tried to make this a safe zone so that those kids can come in here, and they do.
It's very busy, and you got to be able to multitask. Some students come down a couple times a week, complaining of upset stomach, could just be anxiety. It's important to be able to multitask and learn this. I will see you tomorrow. I'm just talking to them at their level, getting down to them face to face, talking to them, things like that. A lot of these kids are dealing with so many different stressors in their life. You don't know on a day-to-day basis what they're going through. We have big poverty in our neighborhood. So we're really lucky here at this school. We have parent advocates, and we also have gala youth services with community. So that's amazing that we have that right here in our own building. And also having like continuity of care. They see me every day. And that's something that I think is important, because some of them don't see family members or certain people in their life every day. So they know that I'm always here.
Here we have 1st grade through 6th grade. And one little girl, she has pretty good asthma. She needs an inhaler. And to see her want to come in as a 1st grader and trying to teach her how to properly use the inhaler and watch her grow as she goes through 2nd grade and 3rd grade, and her maturity level and how she's taking care of her own body. So just to watch them mature and grow, it's amazing. Oh my goodness. I mean, I do 30 prescription pills to kids a day. They need a nurse to give that. You can't have Aunt Mary doing that. I've got tons of resources through community. If kids need anything, clothing, dental care, physicians. I have that. It's so easy for me.
If they need help with, physicians, things like that, we have a complete circle that we just go to. We can refer them to, a pediatrician, a dentist, eye exams, things like that. So I think knowing how community works and getting their resource, it helps us get the resources out to them.
I have such an amazing support system with community and my supervisor and director of nursing and all of the staff here. We are one huge cohesive group. We work together. We have one goal, and it's to care for these kids. That's one of my goals, is to make sure wherever they're transitioning to next in their academic and their life, that I've helped make it smoother if I can.
Absolutely love it. I've been a pediatric nurse for 19 years and I've been in various fields. And by far, I feel that I'm connecting with everybody here. I mean, the staff here is amazing. The kids are amazing and they make a difference in my own life. That's why I do what I do.
Okay, so what's some takeaways from the video and some additional skills?
I like
the-
that she said it was a safe zone for the kids.
Yeah.
And she provides extra clothing if they needed it.
She also has like personal attachments to seeing them grow and mature.
Yes.
Seem to have a good support team with, like she said, with like her director of nursing and the other members of the nursing staff.
Anyone interested? School nursing, you're off summers and every weekend. But the thing about now that the trend is now they have something year round, even if it's not year round school, they have your contract would be for that main 9 months, so that 180 days. But then they offer something after school, before school, during the summer now. So those are opportunities that you can, in addition, you can take advantage of, or you can just have your summers off and, just come back that next school year. But yes. So
And
it
some
is,
schools are year round too.
yeah, and some schools are year round. Exactly. Okay, so we're going to change gears here. Any questions or concerns? We're going to move on to our case study. Let me get it pulled up on the screen. And the way we're going to do the case study, I have some poll questions, and you will answer the poll questions, and then we'll talk about them and just ensure that you understand the concepts that way. All right, let me pull it up here. And share the screen. Here we go. Okay, so you are the nurse at the local hospital in an urban area. So is urban, is that country or city?
Country.
City.
City.
City, okay. So in the past month, you have discharged the following 10 clients between the ages of 23 and 35 who were hospitalized with short-term complications of uncontrolled type 2 diabetes mellitus. Okay, so we have females, we have males, we have different ethnicities, different races. And so we have to consider all of those things when we're trying to come up with a solution or intervention when we do our discharge planning. So our discharge planning, for example, in a gist would be the same, but it's not going to be the same, because then you would have to gear your discharge planning towards, for example, if we were doing discharge planning on dietary, what would our discharge planning conversation pretty much be about? We know that Latinos pretty much like what types of food?
Rice.
Carbohydrates.
A lot of carbohydrates. So yes. And so what about, go ahead. What'd you say?
I was just gonna say rice and beans.
So what about African Americans? So what was, for the most part, we're not saying all, but for the most part, dietary instructions would be about what, because we know that they partake in a lot of what?
High fat, fried.
Fried, okay. And so all of these have been in the hospital for uncontrolled type 2 diabetes, but do you see how the conversation is going to be the same, but it's not going to be the same, because you want to identify those specific things for that population so they would understand. But hey, for example, when you're eating this fried food, you need to change to baked food, or you might want to eliminate white rice and choose brown rice. So you see how you would change your conversation. You provided the dietary instructions about a disease process, but it's specific.
And religion too could play a factor. They
Exactly.
can't meet certain things, right?
Exactly. Great. Okay, so I'm getting ready to launch my poll. So I had placed this document in the week 2 announcements, and in preparation for class, we told you just to think about what are some risk factors or concerns of the community nurse to review primary, secondary, and tertiary, which you all did really well with that. We talked about healthy people 2030. We talked about cultural competencies, community-based, and community-oriented. So let me stop sharing. I'm going to post my poll, launch my poll, and then I'll give you all, the first one has 2 questions in it. And so we will give you 3.5 minutes to read and make your selections. And I'm going to launch it. Do you all see it? This is week 2 case study.
I see it.
Okay, so I put my little timer on. What did I say? 3.5 minutes because it's 2 questions. So 3 minutes. And then we'll talk about what the answer is and is not. Clock it. Timer. You have 1 minute and 49 seconds left. And again, if you have not placed your name and your campus in the chat, please do so. All right, we have 40 seconds left. Getting ready to end the poll. I think everyone has answered. Okay. I'm just going to end it because everyone has answered now. Then we can stop the little timer in the poll. Okay, so it doesn't show who said what, so don't be alarmed with that. So are you all able to see the results? Okay, so let's talk about the first question. Which 3 of these tasks, risk factors, oh, that's my little timer. I thought it turned off. Risk factors for uncontrolled type 2 diabetes mellitus are most important to consider when planning care for clients at discharge. So Select all that apply, and I believe everyone did not. Let's see, obesity, lifestyle, sedentary, and hypertension. So, asthma, why didn't you all choose asthma? Let's talk about what you did not select.
I'm sorry, did you say,
choose?
Why didn't you all choose asthma?
what was the question?
Why didn't you all choose asthma? I mean,
Because
that was
it's-
correct, but I
I
just want to
don't-
see your thought process.
not
Go ahead.
related. Just because it has to do with the respiratory system, you know, the lungs, you're breathing. And in my mind, it didn't have anything to do with insulin, glucose, the type of disorder.
So yes, I asked the reverse questions too, because sometimes hearing how someone thinks about why they did not select something, it helps you with your thought process. So yes, so that's good. Okay, so let's flip it. So why did you select sedentary lifestyle?
Because
if they're
that's
not,
some, I'm sorry, go ahead.
because if they're not exercising, they're not helping to move the blood around or anything like that. And they'll be obese, being sedentary, not moving around.
And so they're not using up those calories. And so they're eating the food. And so those calories are not being utilized. And so what does that do for those glucose levels?
Elevates them.
Exactly. Good, 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 good. Okay. All right. So hypertension, sedentary lifestyle, obesity, were all correct. All right. So let's look at number 2. What would you need to know about this population with uncontrolled type 2 diabetes to help them plan for their care after discharge? Okay. So why did we not select number of children?
Because your children have nothing to do with you controlling your diabetes or not control.
Exactly. Some answer choices you all are there not to trick you, but it's like a distractor. So don't get confused when it says select all that apply. But if you know one of the answer choices has nothing to do with whatever the concept is, you know, don't select it because it says select all that apply. Okay, good. I did get on that one. Okay, let's launch our next poll. Let me stop sharing and go to our next poll. Let's see, go back. This one right here and lunch. Now this one has 5 questions, so we'll give you a little bit more time. And lunch. Okay, let me set my little timer.
Baby boy.
Just about a minute left. Make sure you're participating with the questions because it shows, you know, your digital footprint, who's participating, who's not. So your time is almost up. We have everyone has participated. Let's look at this first one. In addition to medication and follow-up, which of the following would be most important to address in discharge planning? And so that's another, when you're reading the questions too, look for those keywords. When it says most, how do we know teaching or understanding took place? Look for those key phrases or words. So this is following with most be important, would be most important to address in discharge planning. And it is, I do agree with you all, blood glucose monitoring.
Dr. Ford, we can't
Are you able
see
to?
that.
Yeah,
Can
we
you put
can't
it
see
back up?
nothing.
Oh, let me end the poll and then share results. Thank you. Okay. All right, so are you able to see it now? Okay.
Yes.
Great. Blood
Yes,
glucose
thank you.
monitoring was correct. Great. All right. Who is the best person to contact to find out about the hospital's involvement in community care for people with diabetes? Why would it not be the chief executive officer?
Because he or she is over the entire hospital, and not just interested in a certain or specific area. Like his job is very broad, his or her job.
And so whose job is more specific to community? Who has to seek out those resources when they're getting ready to discharge people back to the community? Who's that person that most would be called upon, that is called upon?
Social worker.
Social worker, director, social worker, yes. Now, he or she, the social work director, might have to have the client advocate or the chief medical officer, or some of them do a task or ask a question, but the director of social work is going to be that key person for that involvement of community care. Okay. Where would be the best place to get valid and reliable data to determine if diabetes has increased in the community over the past 5 years? And most of you all went with the local health department. So why don't we go with that?
Because it asked for your community.
And that place is there for the community. So a local nurses association, think about, so the concept is about diabetes, but to be more specific is the place, the concept really is the place that you're getting data from. So about a community. So will we be getting any data about the community really, about diabetes from a local medical association, about the community? Usually associations, who belongs to those things? The local nurses association, who belongs to the local nurses association? Just the nurses, just the and for local medical, just the healthcare providers, and they may or may not. but those would not be good places to find that information. But that local health department is a resource that's for the entire community. And they may or may not do if they've never been to that hospital, then they wouldn't be listed. They would be part of the community, but they wouldn't be listed on that hospital. This would not be a reliable place because that wouldn't be the community. So do we understand why the hospital diabetes registry would not be the best place? So all of these are places that you could find some information, but the best place that you would get the most information that's valid and reliable would be from that local health department, because it serves the community, no matter if you're part of a local nurses association or if you went to that hospital or the other hospital that's located in town. Are we understanding that? Any questions about that?
So the two, because it says multiple choice, so the two would be the local health department and the hospital, correct?
That would be the most, but the very best one would be the local
Is
health.
your local, right,
Mhm.
health.
And then we would dial it all down: hospital, diabetes registry, and then local medical and nursing would be probably neck and neck. So yeah, if you would have to order them, put them in order, yes. All right. Which data would be most important to determine if diabetes is an increasing health problem in your community? Okay, most said the incidence rates for the community. So what's the difference in incidence and prevalence?
I was going to ask you that question.
Anyone, what's the difference in incidence and then prevalence?
Is the incidence what's actually happened and the prevalence is what could be, like the possibility outcome?
Yes. Yes. It's more specific. Yes. The incidence is actually, those are actual, more factual numbers. Yeah. And then the question says most important. So when you read these answer choices, it's like, oh, all of them could really apply. They could, but go back to the most. And then you just start do process of elimination. So why would obesity rates for children and then obesity rates for adults not be the most important to determine it? How do we automatically eliminate those?
It wasn't asking for obesity rates.
Exactly.
I mean, yeah.
Obesity rates, exactly. They threw diabetes in there, but it's specifically, and then to take it a step further, this one leaves out who? Obesity rates for adults that have diabetes leaves out who? It leaves out children.
Children, right,
Everybody
and
else.
opposite, right.
And then the children leaves out the other. So when it says most, for the most part, all the answer choices could be correct, but then you have to like, wait a minute, now which one gives me the most information? So you would eliminate those. Okay. All righty. To be able to better understand factors influencing the occurrence of diabetes mellitus type 2 in your area, which of the following data would most be helpful? Okay, and local community diabetes incidence rates by race, ethnicity. Okay, most of you all selected that. So why would national data on diabetes incidence rates by gender not be most helpful?
Because it says national, so you're trying to assess the community that you're in and not nationwide type of data.
So again, those keywords would make something not most helpful. National. No, I'm talking about the community. So, and it says in state, it's talking about your community, but it's not specific as your local community. So good. Okay. Just two more questions and that will take us on to our time. We have 7 minutes left in our class. It is an hour and 40-minute class. We haven't taken a break, so we should be dismissing here pretty quickly. Let's see here. Last poll. Let's go back. And I'm going to lunch it. Okay. Okay, getting ready to end the poll because I do want to give you your break, and I do not want to run over. I see everyone has not participated almost, but we're gonna go ahead and end the poll so we can. I'm sharing the results. Okay. All right. So which factor for poorly controlled diabetes is better addressed at the community level than at the individual level? So why is lack of community knowledge of health diets incorrect?
Not everybody eats the same food. Not everybody has the same diet. Right?
Okay. And then as far as when we're talking about, it's saying better address at the community level versus individual level. So you're leading us in the right direction. So health diets is more individualized, but the question wants you to select something that's more community. So more community would be the space where people can actually go, like walking trails and things like that. So that's for the community. When you talk, if you selected diet, that's more individual rather than community. So look for those keywords and phrases. Which is the most significant evidence you could present to the Board of Health to help with their deliberations? So we got that one. Hospital data. Yes, I agree with that one on diabetes prevalence in clients. Good. Which of the following individuals needs to be involved in planning the walking path? So the school district superintendent, the public health nurse, local residents, the high school principal. So why would we not have selected the physical education teacher as a top person? Because some of you, I were like, not really. Why would we have not selected the physical education teacher? We could have, but we really didn't need to, because that person is more what? Specific to their entity. So they're more focused on physical ed. But if you have like the school district superintendent, it is more broad. And so we're planning a walking path. And we actually did this right here. It was a project for our seniors. They had to do a project, and that was something that they presented to the superintendent. They actually went to the superintendent and board. They really did that. And so that's what they actually had to do. Okay, it's 6:30. And so I do want to be respectful of your time to give you your 10 minutes break. Please reach out if you think you need some additional time spent reviewing concepts for the exam that will be during our next class period. Please review all the recordings that are there. And before you dismiss, and I think all of you all are my students, but I just want to call, if you are here, I need you to answer present by Anna Atkins, Merlene Can, Jurley Douglas, Yashika Drummer, Miranda Hale, Stephanie Jassant, Antivia Jones, Kendra Smith, Trinetta Williams, Shante Wilson, and Samantha Woolley. If I call your name, answer present for the recording. All right, you all take care. Happy learning. Be safe.
I'm sorry, you didn't call my name.
I didn't call you. No, I didn't call your name.
Okay.
No, these were students that are not here.
Okay.
Yes, but I just need the recording to show that they were not here.
Okay.
So yes, please reach out if you want to have an additional conversation to review for your exam that's coming up. Send me a text message or send an email so we can make that happen.
Thank you.
Review
Thank you.
You're welcome.
Thank
Have a good night.
Thank you.
You're welcome.